So welcome everyone to the Justice for Immigrants webinar titled Impacts of COVID-19 on Immigrant Communities and Catholic Responses. So during the webinar, we're going to be hearing about the impacts that COVID-19 has had on immigrant communities throughout the US. And we're also going to hear about different Catholic community responses to the pandemic and how they are working to support individuals and families in need both within the US and along the US-Mexican border. So we will also have time at the end, near the end of the webinar, for questions. So please feel free to type any questions you have throughout the webinar in the chat, and we will get to them once we get to that part. So let me go. Oop. So just to introduce everyone here today. So first off, I'll be moderating. My name is Sarah Hoff, and I'm the CARE Program National Coordinator with the U.S. Conference of Catholic Bishops Office of Migration and Refugee Services. And we're joined here today with some great presenters. So we first have Daniela Alulema, and she is the Director of Programs at the Center for Migration Studies. And we also have Marissa Limon Garza with Hope Border Institute, and she is the Deputy Director there. We also have Deacon Gabriel Cuervo, who is the Director of Field Operations with Catholic Charities of South Carolina. So let me stop sharing my screen and I'll hand it over to Deacon Gabe, as well as James Kaiser, who works with him as well. So go ahead.
Well, thanks everyone for being here, and Sarah for the invitation. In Catholic Charities in South Carolina, we were also facing challenges with the pandemic, and so we decided to help our community, our peoples, with one tool that we find out is very flexible, very important to have in this particular program. But I will let James Kaiser, who is our executive director and who actually introduced us to this tool, to share with you and to give you the information that you need to know.
Thanks, Deacon Gabe. Hi, everybody. Hope you're having a great day. I want to say thanks to the MRS committee and Sarah and her staff for the chance to talk. So I'm going to try to be concise, and I'll give you a little bit of overview. In Catholic Charities of South Carolina, we cover the entire state of South Carolina, and we were looking at doing some type of response to mental health needs throughout the state. And we have a lot of migrant communities in the agricultural field and industry. Plus, we also have a lot of tent homeless communities, particularly in the upstate. In one county, we have over 100 different tent communities. So we wanted to be able to provide mental health services to those on the periphery. And in looking to do so, we came across a ministry that I had previously been affiliated with a prior job. And essentially, it's a very creative, innovative tool ministry that I'm going to give you a lot more detail on now. So first, we'll start with the problem. I mean, with COVID, obviously, everyone being isolated, face-to-face not being viable. You can do telehealth, but there's still a lot of barriers to people gaining access. And particularly within the migrant refugee community, the main problem is that they're not in one location. There's a lot of constant moving, and to have a counselor and develop a relationship with anybody becomes incredibly challenging because of the inability to foresee kind of where you're going to be in a year or a month. So that for us here was one of the reasons we went with what we call the Hope ministry. And the background of Hope is that it's a mental health chatbot. So what that means is that anybody who has a phone that can just basically has text functionality, you don't have to be a smartphone. As long as you have the ability to text, you can have 24/7 access to this support. And so I'm going to go to a PowerPoint now and give you a little bit more, some of the problem reasons we wanted to do this, and then explain the ministry and the impact here in South Carolina. Thanks. So mental health effects on COVID-19. Since 2019 to 2021, there's a 4-time increase in anxiety disorder and depressive disorder symptoms. There's also last year in 2020, 1 in 6 people for the first time ever sought out mental health support. Now, within the migrant and refugees communities, because of the lack of secure shelter, because of potentially being mobile, these negative side effects are greatly, greatly increased, and also just the lack of access to care at times too. So the other, I'm sorry, hold on here. There we go. Sorry, having a little technical difficulty here. Sorry. So 1 in 4 people need mental health support just throughout the United States in general. And you have only there's about 1 in 50 have access to trained professionals. And that's far less, that number is much, much greater. There's a much greater need for help and lack of access within the migrant refugees community. That's been well documented through research. The other main reason we decided to go with a chatbot is because stigma. Now, the main reason why people don't seek out mental health support is because of stigma. And in different cultures, that has a lot more gravity than in others. And the other thing too, though, is that a lot of the current research for younger people, particularly those under 30 and teenagers, because of their proclivity for using text and chat kind of technology, on average 300 to 400 times a day, they are 6 times more likely to engage with a chatbot for mental health support than any other type of service based on the research. So we really are also trying to respond to the needs of young people and to be preventative in what we're trying to do here. And this ministry provides, an unscalable, essentially psychological education available 24/7 for the entire population of South Carolina. Everyone in South Carolina could use this at the exact same time, and that would be no problem at all for this tool. So the scalability is a great asset of it also. But the main thing that really attracted us was the preventative dimension of it. And what it does is it teaches people simple best practices that allow it to, to self-teach themselves how to manage kind of some of their mental health challenges. And so the preventative dimension and the fact that it helps to get around stigma were 2 big attractions for us with this. And the ability that, for people on the periphery, whether they're homeless or in a migratory situation or a refugee, they can take this with them wherever they go, at least within South Carolina. If they're moving around, this is with them wherever they go via text. So this is getting into a lot of why we went with the mental health chatbot versus more traditional models. Because I frankly, in my agency, we couldn't afford to hire counselors all over the state to go try to do in-person counseling. And this provided a very economical alternative. And we'll get into more of the detail on what it actually, the impact here. So the vision behind this is a tech company that was created about 10 years ago, okay, that we have partnered with at Catholic Charities. And their vision was to be able to provide affordable, on-demand emotional and mental health support, regardless of income or location. Okay, so they have been doing this for many years. They have over 22 million participants, and they've been working in various cultures and languages all throughout the world. And I'll show you some data on that later. But this summarizes why we went with this. It's proven to reduce symptoms, and it provides a unique preventative approach. And practically, people can interact and get direct feedback. And everything that the chatbot says is written by clinical psychologists, okay, that have written down their conversations that they've used with all of their clinical clients. And it's all been saved essentially in the system. And so when someone brings up a topic, the system responds with clinical advice. So that's basically how it works. But it's available 24/7. Anytime somebody wants to access it, it's available and provide, some concrete advice. Plus, it's not only reactive, it's proactive. So if you interact with it and ask a question about, saying I'm feeling down or something, and it gives you some basic advice, it will follow up with you, and it will text to see how you're doing and how, whether you've implemented the advice and whether it was helpful or whether there's any other issues you want to discuss. So it reaches out to people to stay engaged with them to see if they need more help too. So moving to us here in South Carolina, we launched this right after COVID started in April 2020. And after 6 months, this is a summary of the results. We made it available in Spanish and English from the very beginning. It's had an 86% helpfulness rating. Now, we offer this just to the general public, obviously to our own clients and current clients, but to the general public at large. And so that's a very high helpfulness rating just going to the general public. But the main thing that was powerful is that after 6 months, it had performed 2,600 hours of traditional counseling, which would have cost us over $200,000. Now, we paid essentially less than about 5% of that to perform this type of service. And it's just impossible to scale at this level without a technological tool like this. And the other thing that's very powerful about this is that it has built-in suicide mitigation intervention, real time. So if someone is texting saying, any kind of suicidal ideation about thinking about taking their life or planning to do so, real trained clinical suicide interventionists will start texting with that person and try to get them on the phone real time to stop that. And this is also generating about 65 potential referrals a month. So about 65 times a month, it's interacting with somebody who has a more serious problem, identifies that and says, you should seek counseling. And it also has the ability to connect people real time to counselors. If you have that already as part of your organization, this is a great way to get more clients if you're looking for that. For the rest of this year, forecasted out, it's probably going to perform about at least, we're looking at 75,000 hours of conventional counseling, which would be worth over $500,000 we would have had to pay for that type of service. And the other thing I want to emphasize for this audience is this remains with them wherever they go. If they're on the move, as long as they have the phone number, they can continue texting that phone number and continuing to interact with Hope and getting advice on how to deal with their issues. Practically to reach so we have about, on a consistent basis, 1,000 different clients at Catholic Charities. And I'm going to share a different screen. I'm going to show you now the dashboard that if you decide to use this, if your organization wants to offer this, this is what you see as the organization about who's being served, how it's being served, and all the data that it provides, which is great to represent to boards and to donors. So I'm going to share another screen right now and share that with you briefly. Sorry, give me a moment here. Apologies, got the wrong. Whoops. Here we go. So you can see this. This is real time here in South Carolina. This shows you the helpfulness rating. It's about 87%. Shows you all the different issues and emotions people have addressed. And down here, it shows you the total users. Around Thanksgiving, we added a substantial number. We did a Facebook ad campaign. We also have integrated this into social media, which has been very powerful for us. So that means anybody who just has internet access, they don't even have to have a phone. They can interact, with this and get feedback. But down here, you can see it provides real time the exact amount of hours worked and money saved and the number of suicide interventions it's done in the last 30 days. Plus, it gives you feedback on social media versus in person, and you get a lot of concrete positive feedback from actual participants. Right here, I enjoy the help. You are a beautiful natural healer. It's pretty amazing a lot of the feedback you get, but it's so this is all confidential. It's all privacy. There's a privacy policy that goes out. It's transparent. It tells people right up front. It's a chat bot, and it so I'm going to move on to the PowerPoint now. Sarah, how much more time do I have? If you don't mind.
Just a couple more minutes. That would be great.
Okay, great. So I'm going to just give you a little bit more background now on the actual company that we're partnered with, so you can understand kind of the scale of this this ministry. So I'll go with this. If you're looking at doing this yourself, which we, from our experience, would strongly encourage, it's a great first step if you want to try to provide some type of mental health support, because it's got unlimited scalability. It's proven effective by multiple research partners and scientific studies, and it reaches the peripheries of society. Our users don't pay anything to use this. They can use it as much as they want without any fee or cost. We pay we think, very economical one-time annual rate, and then anybody is unlimited number can use it. It's just a number of people we can get to try it and to benefit from it. And it's 24/7. I mean, it's with the migrant and refugee communities, the fact that as long as they don't change their phone number or keep the phone number by which they can text HOPE, they'll never lose access to this support for them. So, that's why we were really happy to be able to present this, Deacon Gabe and I, to the Justice for Immigrants Network, because we do think it's a really great tool for those serving that, the migrant and refugee population. So who uses the technology platform behind HOPE, and how is it safe? First, we'll talk about who's using it. There's over 75 customized chatbots for over 10 years from all over the world. And this just gives you a brief kind of overview. One of them, when it comes to refugees and migrants, they launched this in about a year after the major migratory situation in Syria started a number of years ago. And they offered it for free to all of the migrants and refugees. And the company paid over $1 million to translate everything into Syriac, so they could offer it in their own language on the ground. And that just meant, putting out posters with the phone number, or handing out little business cards, to just let people get the number, and they can text it and they can use it whenever they want. And then these are some of the corporations. So this has also been used by a lot of major corporations for many years to provide to their employees. So this is a well-proven product. You don't need to worry about, this is not in any way new. It's Coca-Cola, ARP, Ford Motors, United Way, Nationwide, a lot of major healthcare systems. They've all been offering this for years now. And then also the research partners is the next slide. A lot of major universities have been doing research on all different types of ways this can help people, from anxiety disorders, suicide prevention, intervention. It covers over 200 different areas. I should say it has over 2 million different module topics within the system to address all different types of issues that can come up. And it incorporates over 200 different types of psychological mental health approaches into the system, into kind of the methodology. And here's just some of the critical research about it being effective. This is based on very large peer-reviewed studies, and it's been proven to reduce symptoms of depression, anxiety by 28% and 18%. So with COVID, these are very common symptoms for everybody just under COVID. And I think that's much higher likelihood within the communities in which everyone here serves. And the other thing, it's got a lot of high engagement. With HOPE, we have consistently had over 1,000 participants, and it continues to grow pretty much every month. And you see about down here, 7 to 20% of the people that are offered this will try it, and frankly, will stay engaged with it to a degree, which means over at least a few weeks, a few months, that it can be meaningful for them. So it's actually helps people, and people like to use it. And here's just all of the research that's out there that's been put into this with major research partners. To give you a sense, this is a summary of the tech company behind HOPE. The CEO and founder worked at IBM on the Artificial Intelligence Deep Intuitive Mind project, and then left there and started a research institute and built this company. And I'm one of the advisors for them. And there's also a member of the USCCB Lay Advisory Board. That's one of their advisors, and also investors. So, this is just to give you a sense of kind of, the fact that this is not a Catholic Charities product. This is just, we've partnered with them to offer this. And really, that's the end of my presentation. I hope I've been able to, give you a good sense of what this is. But if you, so a summary, it overcomes stigma, extremely convenient. You just need to text 24/7 on demand. 3 million conversations, 800 topics, and real-time suicide intervention. And if you have interest in this and you'd like to find more information, you can contact Deacon Cuervo, who's a member of the committee. Sarah, I think that's it for me. Thanks.
Thank you so much.
Let me end the screen share here.
Yeah, if you could just end sharing. Great. So now I want to introduce Daniela Alulema. She's with the Center for Migration Studies, and she's going to share a little bit about what the CMS has been doing regarding research around the impacts of COVID-19 on different immigrant communities. So Daniela, do you want to go ahead and start?
Absolutely. Good afternoon or good morning to everyone. Greetings from Queens, New York. And I also have a PowerPoint presentation, so I'm going to share it now. And I hope everyone can see it properly. So, as Sarah said, my name is Daniela Alulema, and I'm Director of Programs at the Center for Migration Studies. We are a think tank dedicated to studying international migration and also promoting policies that protect the rights and dignity of migrants, refugees, and people on the move. And as we know, the COVID-19 pandemic has exposed deep racial and economic inequalities in the United States, and the pandemic has severely impacted migrant, refugee, and other vulnerable populations, and has imposed restrictions on mobility. And as we're moving on from the Trump administration and we collectively are working to undo the damage that the administration has inflicted on immigrant communities over these last 4 years, we're still living with the repercussions of the federal response during the Trump administration. And just to name a few, for instance, the United States closed its borders to asylum seekers who are fleeing conditions of violence in their country, and instead created conditions of insecurity, risk, and chaos at the border. Also, thousands of immigrants are still detained despite the risk of COVID-19 transmission in crowded jails and detention centers run by ICE. In fact, 2 immigrants have already died in detention this year, and one of them from complications due to COVID-19. The Trump administration did not suspend the public charge rule either, which undermines the safety of immigrants who are in need of social services, yet fear jeopardizing their chances of adjusting their status in the future. We also should remember that Congress left out millions of mixed status families and undocumented workers from the CARES Act last year by excluding them from receiving stimulus checks, which at this time are essential for low income and working families who are struggling in the middle of the pandemic. And this is too, in one other aspect in which immigration has been part of this situation is that thousands of immigrants are working in critical infrastructure and are putting their lives at risk in the front lines in this fight against COVID. And in these 27 days of his administration, President Biden has already taken several measures to undo Trump's policies against immigrants. And some of them include, for instance, the reversal of the Muslim ban, also a 100-day moratorium on deportations, his commitment to increase the number of refugees resettled, and his order to preserve and fortify the DACA program. And as you may have heard, today, the U.S. Citizenship Act of 2021 has been introduced. And this bill would represent the most sweeping immigration reform legislation in decades and would lead to the largest legalization program that we have seen in the US history. And we commend the administration for taking action on immigration, but there's still a lot of work ahead of us. And the administration needs to ensure that the protections will be permanent and will include a path to citizenship. So, okay, perfect. Last year, the Center for Migration Studies created a webpage to document and to keep track of the different ways that migrants are being affected by the pandemic. So that second bullet point includes a link to this webpage that includes updates about US policy federally at the state and local level, as well as extensive policy analysis and research. So I invite you to check out that webpage whenever you have a chance. But today I wanted to focus on essential immigrant workers. CMS produced a report with detailed estimates of immigrant workers in the United States who are in essential critical jobs. And our report shows that immigrants are present in high numbers in essential jobs. This presents an interesting policy paradox where immigrant workers, particularly the undocumented, are deemed essential, yet they do not have the necessary protections and recognition that they deserve. And just a quick note on how we arrived at these estimates. So we matched the essential critical infrastructure categories set forth by the Department of Homeland Security to the industry codes in the 2018 census data. And we then used 2018 data from the American Community Survey to estimate the number of immigrant workers in each category. It's important to remember that some workers may have been furloughed or lost their jobs since 2018. But our main finding is that a significant portion of essential workers are immigrants. We estimate that 19.8 million immigrants work in essential jobs, and out of this group, 9.6 million are naturalized citizens, 4.6 are legal non-citizens, and 5.5 million are undocumented. In addition, immigrants represent 18% of all workers in essential jobs nationally. In fact, this share is higher in certain states. So for instance, in California, immigrants make up 36% of all essential workers. In New York and New Jersey, the number is 31%. And in Florida, it is 28%. And in Texas, Hawaii, and Massachusetts, it is 24%. And we can take a more granular look at the percentages of immigrant essential workers in the labor force. The table here presents the highest immigrant shares of essential workers by metro area. And we see that immigrants represent 53% of essential workers in Miami, Fort Lauderdale, and West Palm Beach, 50% in the San Jose, Sunnyvale, Santa Clara area, and 47% in Merced, California. And according to our estimates, too, 6.2 million essential workers were not eligible for payments under the CARES Act. And one of the most startling statistics that we found was that 1.2 US citizen children living in mixed status households below the poverty level were part of families that did not receive any sort of support from this law. Now we can take a closer look at data on immigrant essential workers by sector. And we continue to see this trend of high employment rates and contributions of immigrants to the country's critical infrastructure and the well-being of our communities during the pandemic. And just to name a few, immigrants are vital to healthcare, either by providing healthcare, working with patients with COVID cases, working as home healthcare workers, aides for the elderly, working at scientific research and labs, or manufacturing medical equipment and pharmaceuticals. Immigrants are also vital for sanitation. They constitute 28% of janitors and building cleaners and 23% of workers in disinfection. And immigrants are also vital to food supply chains. They make up 31% of US agricultural workers and 26% of workers in food and beverage manufacturing and processing. And just to conclude, the virus does not distinguish, as we know, between people based on immigration status, and it does not diminish the need for protection of immigrants and their children and families either. And globalized diseases like this pandemic require a coordinated global response rooted in solidarity and facts, but they also require countries to honor their domestic and international obligations, protection obligations. And migration should be managed in a way that respects human rights and protection standards. And the United States must treat all of its residents, including immigrants, either undocumented or documented, as full participants in their communities and not as disposable labor. So with that, I'll pass it on to Sarah.
Great, thank you so much, Daniela. I'm now going to pass it over to Marissa Limon Garza. She is with the Hope Border Institute, and she's going to be sharing about their work that they're doing along the border.
Hi, folks. Thank you so much for the opportunity to join you all, and thank you for participating in these very important webinars. My name is Marisa Limon Garza. I am the Deputy Director of the Hope Border Institute, an organization in El Paso, Texas, so right on the border with Ciudad Juarez. And we are an organization focused on social justice and human rights from the lens of Catholic social teaching. And our work is based in policy, in research, and in leadership development. We also operate a humanitarian fund that works in Ciudad Juarez and allows us to support migrants and asylum seekers that are in the area, many as a result of the Remain in Mexico or Migrant Protection Protocols program. So I wanted to first speak to some of the great models that we have in Ciudad Juarez of ways that folks have had to combat the COVID-19 crisis. Building upon what has already been shared on this call, we know that COVID does not distinguish among people, and so migrants and refugees are also quite vulnerable to the pandemic because they are oftentimes in congregate settings. Right now in Ciudad Juarez, are approximately 21 shelters that offer housing to migrants and asylum seekers in these programs. There are approximately 1,000 people in that network, and there's another 5,000 or 6,000 people outside of that shelter network. And so it became very clear early on that it was essential to keep people safe and to keep these shelters COVID-free. There are many international organizations and UN actors on the ground in Ciudad Juarez that are trying to help with this, with the pandemic and of the realities with migrant communities. And they created and provided tents for quarantine for all of the shelters as an initial good first thought. And while those have been helpful, it was ultimately decided that a filter model was actually needed for folks to quarantine for 14 days before they actually entered the shelter area. So that helped tremendously with the flow of people and how to keep people safe. This initiative began in May of 2020 and has continued to the present. It was initially thought to be a short-term plan for 3 months and has now been extended. It is principally supported by the International Organization for Migration, IOM, and it is made possible in partnership with many other actors on the ground, including the Border Refugee Assistance Fund that we support. And so this program offers a space. It's a hotel that has been rented out in full. There is medical staff on site. The medical director is a person who is a doctor who has lots of experience working specifically with migrants. And then the migrant community themselves, there are several Cuban doctors as well that are in these programs that have then been supporting all of these needs. And so people arrive at the Filter Hotel. They are quarantined for 14 days. There is not an initial COVID test provided. Instead, people, if they start to display COVID symptoms, then they are tested for COVID. And there is a separate COVID wing of the hotel that provides for them. There is food that is provided every day, psychosocial support that is also provided for folks as they determine, their path forward. And there is a thoughtful matching process based on the population in the hotel with the groups of shelters that are available and seeing, okay, you're a single adult male, maybe this shelter would be best for you. You're a family with children, maybe this shelter is better for you. And so that is a really thoughtful approach and has really helped make the hotel successful. They have, for reference right now in Ciudad Juarez and in the rest of Mexico, here in the United States, we can access COVID testing oftentimes, sometimes free of charge. Sometimes our insurance is able to cover that cost. In Mexico, that's really not the case. If you wanted to get a rapid antigen test, right, that costs about 700 pesos, which is approximate 37 US dollars. If you would like to get a PCR test, which is oftentimes a test, that is 2,250 pesos or 112 US dollars. And so obviously these are tests that are out of the reach of many people in Mexico, period, let alone migrants and asylum seekers. And so part of our work with the fund is to be able to hotel with access to these COVID tests with a private laboratory, and the laboratory goes directly to the hotel and provides testing on site so that people can get the results in a safe and confident manner. And so it's been incredibly important for us to make sure that that infrastructure remains and is strong. We're now looking at a situation where you've probably seen in the media that there is going to be a wind down. We already know that the Biden administration stopped the Remain in Mexico program formally in terms of people being into the program. And now we're seeing what it looks like to actually release people through parole into the United States to reunite with sponsors and to consider and continue their asylum proceedings from those locations in the interior of the country. We are now mapping on this additional need to our local context when it comes to COVID prevention and COVID preparedness. So our community will begin on February 26th, so a week from tomorrow, receiving people in very small groups. We're talking about 25 people that will be going through a process in Mexico of going to a staging facility, taking a COVID test, getting a negative result, God willing, and then moving on, being escorted to the port of entry, going through processing, and then being released into the US. This is starting this Friday, as in tomorrow in San Diego. So you'll be able to kind of look out for that and see how that process works there. On Monday, the 22nd, it will begin in Brownsville and Matamoros. And then the following Friday, as I said, the 26th, it'll be in our community. And so this just shows, it's an effort to recognize the international right to seek asylum, along with the opportunity to make sure that we control for COVID. And so it's required a lot of planning and preparation. There are regional plans all across the southern border. Communities have been preparing for this since 2020 and now well into this year. And so our ask really is for people to champion these efforts, to support these efforts. Ultimately, we our US government to come to our border. We know it's a pandemic, but we have so many people on the move. It's important that people see for themselves, administration, what the realities are and what this looks like for borderland communities like ours. I did say 25 people a day. That is what the starting number is. There is a goal to increase that to approximately maybe even 300 people a day. Our US shelter record here in El Paso is Annunciation House, and they are prepared. Yes, at each site. I'm just trying to answer quick, real time from the chat. At each site would start with 25 people and could increase once they get the kind of kinks worked out to maybe up to 300 people at a time. Right now, there's estimates that there are 26,000 people with active cases in MPP. So that's the number of people they're trying to move. So this allows a need for community mobilization, for preparedness. There has been a lot of preparedness and thoughtfulness on the Mexican side of the equation with the UN agency partners. We know that UNHCR, UNICEF, and IOM, the International Organization for Migration, are all playing key roles. And we're now really being thoughtful about what happens on the US side. And so there are implications for communities in the borderland area like ours. And what does it look like for resources that need to be made available? So we will continue to be doing this work and advocating at the highest levels for the needs that we have to meet these, meet the moment and meet the demands, and balance an orderly, safe, humane process. And we know that that's all possible. So I'm happy to take any questions when we get to that point later about any of these details, but I wanted to brief you all on both of those realities that we're seeing here in the borderlands.
Great, thank you so much, Marissa. So now I want to go back and we have time now to answer anyone's questions. I know I saw some questions come in the chat, so I'll go ahead and read those out. So the first one we received was from Lisa Steiner, and this was for James and Deacon Gabe. And so she asked, how does the advice get modified for cultural differences? So with Sister Hope.
Sure, yeah. Well, that's a good number of the large studies were done down in Central South America, at least when it comes to Hispanic speaking populations. So that all of that research that's more obviously takeaways or cultural differences, et cetera, is integrated into the Spanish speaking version of, of Hope and the advice it gives. At least within the context of the Catholic Church, I would say the most practical application, or at least thing that we've tried to be sensitive to, is that we definitely, the research shows that let's say spouses, particularly husbands, are much more comfortable with their wives going to talk to with a religious individual or versus secular when it comes to mental health counseling. So that's the type of thing we're sensitive to. So for instance, we on the Facebook version of Hope in South Carolina, we call it Sister Hope. It's like a little nun icon, just to kind of accommodate that kind of cultural difference that's much more prevalent, I think, in Central South America than here in the United States amongst Anglo communities. So that's the best answer I have on that. But there's been a lot of research done in Central South America to try to integrate that, and a lot of the advice that's been gathered has been from all over the world too, from various cultures.
Great, thank you so much. And then we also received a question, another question from Lisa, and then also a question from Yolanda about if there's a common definition of essential workers across the United States, and then how are meatpacking plant workers being impacted. And I think this was for Daniela.
Yeah, so for our estimates, we use the definitions employed by the Department of Homeland Security, which can vary significantly from state to state. And even since the beginning of the pandemic, this list of categories has been evolving. And at times it became more encompassing or broader. So for now, that's the list that we're relying on. But as I said at the beginning, there is a caveat that some of these estimates might include people who have already been furloughed or might have lost their jobs during the pandemic. But we wanted to be inclusive of the estimates as DHS has laid them out. And in terms of the meat packing and poultry packing industries, we know that according to other external research, about 47,000 workers working in the meatpacking industry have been infected by COVID-19, and there have been hundreds of deaths too amongst this group. And we know that certain states, I believe North Carolina, North Dakota, and a couple more, we got updates from them saying that companies are actually handing out safe passage letters to their workers just to ensure that they can continue coming to work, even when some of them were actually in deportation proceedings. So we know that the situation that this industry has been severely hit by the COVID-19. So I would refer you, and I believe I included a link to the full report as well that provides more detail by industry and by state, in case you want to see where your particular state is.
Great, thank you so much. And we have another question. This is probably from Marissa about vaccinations and kind of the difficulties in getting vaccines out to immigrant communities, especially if there's language difficulties or access to computers, technology, and things like that. So do you have any insight about kind of what's being done to kind of try and get vaccines out there?
Yes, so a flip side of our work is binational, right? Both in Juarez and in El Paso. And in El Paso, we've had successful rollouts, really, of the vaccine. I believe, I want to say one in large numbers. I don't want to quote you a number and be wrong. But a vast majority of people in the number of vaccines that we have gotten out to community. Where we are failing is at the equity portion of the rollout. So there are two plans right now. There's one model where our county hospital has like concert ticket style vaccination program where on a Saturday at 12:30 you call and you try to sign up, and they have a certain allotment and they're available that day. There's a separate effort with the city where there's a website portal and people sign up online and get on a list. Obviously, this presents a lot of challenges for people. It privileges folks that have access to Wi-Fi, that have access to computer. Initially, ironically, in a borderland community like ours, the content was still very much in English at the beginning, and then later was like, oh yes, we should have it in Spanish. So we do not have it figured out when it comes to making vaccine access equitable. Now that we're a few weeks into the rollout, things have improved. There's now phone lines, there's now just more options. There's desire to work with people locally. There are local mobilization efforts through the diocese and through other partners where they will really work with people directly and try to help them case management getting online. So it's a very much of a mutual aid kind of model that has been most helpful for people, because there's so many barriers, right? If there's mixed status situations from documentation, immigration status, the social security number was one of the questions that was initially requested. And so that can be very problematic for people. We obviously need everybody vaccinated. We don't want to leave anybody out. And so we have to start really pushing that we think about the plurality of our community from the beginning instead of as an afterthought, because that just really helps no one. And so that's what we're pushing locally with our government officials and with partners to make sure that our community is ultimately safe.
Great, thank you so much. And does anyone else, I didn't see any other questions in the chat, but feel free to unmute yourself. And if you have a question that you want to ask, please go ahead and ask it. I'll give it a couple more seconds if anyone wants to chime in. Otherwise, I have some other questions I can ask. Okay. Well, I'll ask a question for Deacon Gabe and James. So how difficult or what does it take to implement this program in a different community?
Sure, that's a great question that comes up a lot. It's completely turnkey is what I would say, or as much as you're going to find. So for instance, here in South Carolina, the individual who runs our largest field office with a food pantry and 3 or 4 other ministries, she just took this on as an additional task. And really, so you don't need to hire anybody. Once the main thing you need to do is just communicate this. Either we had a video done with our bishop that was sent out in Spanish and English to all the emails we had at the diocese. Also, we did Facebook ad campaigns. We put ads in Catholic papers and other papers, and put posters up at all the parishes. So the main work that needs to be done is just some communication to let people know about it and to explain it. And then we have a website on the Catholic Charities South Carolina website. There's a whole page for this, and you can just go on there and start using it right on the website too. So the main work is communicating it and getting it out to people, letting them know what the number is and what it is about. And then as far as the staff person, she just has access to the dashboard that I showed you that gives you all the data that you would want to know about what's going on. And there are customer service staff that have a Catholic ministry background at the tech company that check in with her about once every 2 weeks. So it's as turnkey as you're going to find. Thanks.
Then I have a question for Daniela. So what has been the impact of the pandemic on DACA recipients?
Yeah, thanks for the question. So another report that we prepared at the Center for Migration Studies is with regards to DACA recipients and their many contributions as essential workers in the middle of the pandemic. And we looked at specific industries, and one of them is the healthcare sector, where over 33,000 DACA recipients have been working either as doctors, nurses, or in other occupations in the healthcare sector. However, DACA recipients can be found across pretty much every industry, from retail to manufacturing to construction to financial services. And right before June of last year, DACA recipients were facing 2 different battles. One was the pandemic, and the other one was the uncertainty that came without knowing the future of the DACA program that has opened many opportunities and many doors to DACA to folks who have grown up in this country and know the United States as their home. Thankfully, the Supreme Court found that the way that the DACA program was terminated was unlawful. However, it did take more litigation in order to get the Trump administration to fully implement the DACA program again. So by December of last year, DHS finally began accepting first-time applications and also started processing advanced parole requests. So it has definitely been a huge relief for the community of DACA recipients. However, once again, we're facing another potential hurdle with the Texas versus United States case where Texas and another handful of states have claimed that DACA is unconstitutional. So I'm a DACA recipient myself. So once again, our future is in the hands of a judge in Texas, and we hope that, of course, the Biden administration and Congress will finally pass a bill like the DREAM Act that offers a path to citizenship. But it's certainly been a very stressful situation for the thousands of DACA recipients who are part of this program, and continue to work and contribute in the country that we know as home. But we're still facing an uncertain future.
Thank you so much, Daniela. And we received in the chat a question for you from Sister Marie, and she wanted to know what advocacy efforts can people take with the administration and Congress?
Well, at CMS, we don't really work on advocacy campaigns, but what I can say is, first I would say with DACA itself, the program is it's open right now to everyone who qualifies for it. And unfortunately, because of the 2017 rescission by the Trump administration, many applicants who would have qualified did not have a chance to apply. So I think it's a high priority for our community to make sure that those young immigrants enroll, apply for the program, and get that, get their EAD and their DACA. Then the second priority I would say is ensure that we, senators and our representatives in Washington hear about us. We need a bill. We need a path to citizenship. We were lucky that we, well, not really lucky because it took a lot of work and a lot of effort to ensure that President Obama passed the DACA program or created the DACA program. But I would say that we need a permanent fix. We've been living for almost 9 years in this limbo while we have been able to work and create a life and buy houses and start families here. We can't continue living in an interval of 2 years at a time without being able to plan or see our future clearly. So it is time for Congress to take action. So it will be an uphill battle. It's still 10 Republicans that need to support the DREAM Act, but we hope that we'll be able to get there. So, and just as a reminder, it's been 20 years since the first DREAM Act was introduced. So it's long overdue.
Great, thanks for sharing. And we received from Isaac Cuevas asking if you know of any national funds that exist to help DACA recipients with paying for fees.
I believe the United with Dream has a fund to help with filing fees, but I have also seen state and local funds created either by grassroots organizations or community organizations that are doing the same. And I have also seen folks doing, GoFundMe campaigns and just trying to raise funds for their own applications or for their friends. So there's a few different ways to raise money for this purpose. But I'll be gladly to look more into what resources are available and maybe share that with you, Sarah, in case you can pass it on.
Yeah, that'd be great. So we have time for one more question, so I'll direct it to Marissa. What can the church do to support migrants in Juarez and Mexico at large when it comes to COVID-19?
Awesome, thank you. So really, number one, I think during the season of Lent, it's to uphold, the rights of these migrants and asylum seekers in our prayers. We are as a country really thinking about what it's like to reimagine immigration writ large, hopefully, we are an organization that really supports the need for comprehensive immigration reform that takes into account the root causes of migration, the complexity of DACA recipients. All of these nuances really need to be reimagined. And so we need that prayerful consideration and mindfulness during this season to have the bravery and the strength and the political will to make those things a reality. Further, we do have a fund that Bishop Seitz from the Diocese of El Paso launched. It's the Border Refugee Assistance Fund, and I can drop in the chat the link to our website that has information on that fund. Those proceeds go to serve migrants that are in Ciudad Juarez right now and are dealing with the COVID-19 pandemic just as the rest of us are, and are trying to be safe when it comes to their care. So any kind of support is obviously welcome. But first and foremost, really praying for our country and our community as we try to continue to bend that arc of justice towards what we need to do towards our fellow migrant brothers and sisters.
Wonderful. Thank you so much. And I want to thank everyone for joining us today. Thank you so much for engaging in this great conversation and for participating and listening. And thank you to our presenters for sharing your work and your insights and some really great information. So this webinar was being recorded, so we will have the recording up on the Justice for Immigrants website, which is justiceforimmigrants.org. And I will also be sending a follow-up email to everyone who registered with that link. And also we can share the slides from this presentation so you can have those as well. So I just want to thank you again and hope you have a wonderful rest of your day. So thank you.